I will talk about the imaging of the ligaments of the knee, and the most important are, as you all know, the ACL and the anterior cruciate and the posterior cruciate. And this is the normal appearance of the anterior cruciate ligament. In the sagittal image, you see the ligament is connecting the posterior aspect of the femur to the anterior aspect of the tibia, and it should be stretched, not lax like this one, but this is the normal appearance of the ligament. And in the coronal image, if you look in the intercondylar notch, you will see the anterior cruciate ligament as a line and part of the posterior cruciate ligament, the horizontal part. You know, the posterior cruciate ligament is like this, and the horizontal part is only seen in the intercondylar notch, this one. Then, if you look to the MR of the knee and you want to see the anterior cruciate ligament, you put your finger first on the posterior cruciate ligament. Then you go an image to the right and an image to the left. Then you, in one of these images, you will see the anterior cruciate ligament. But what happens if you have a knee examination like this and you put your finger on the posterior cruciate ligament and you go an image to the left and an image to the right and you don't see the ligament? Then one of two. Either the wrong angle of scanning or the ligament is torn. Then you go to the coronal image. If you see the anterior cruciate ligament in the notch, this is the wrong technique. If you don't see the anterior cruciate ligament, it's torn. Okay? And this is the way to differentiate between both. Then this is the anterior cruciate ligament. In the intercondylar notch, this is axial image. And we usually scan the patient like this. We in order to do the accurate sagittal image, we draw a line like this, parallel or tangential to the femoral condyle. Then we do a perpendicular line. Then the angle of examination is just 10 degrees to this perpendicular line. This is the right way to scan. And many of the operators do not follow this way of scanning. They put any angle they would like. Then you have a good chance that the anterior cruciate ligament will not appear in the images because of the wrong technique. And in order to avoid this wrong technique and you misinterpret the image as the ligament as torn, go to the coronal image. If you see the ligament in the notch, then the technique is wrong. Okay. Then this is the normal appearance of the anterior cruciate ligament, and this is the posterior cruciate ligament. And I have said that both ligaments can appear in the same image in some patients, but in other patients you may see only one ligament and the other in the opposite image. Then this is the normal appearance of the ligament, and this is the torn ligament. Why this is torn? Because the attachment to the femur is not intact. And you see at the site of tear fluid, and the fluid is bright in the T2 weighted image. Then if you see that the ligament is disrupted and there is fluid signal at the site, then you know that this ligament is torn. Then look at this image, for example. You see, this is the anterior cruciate ligament, and you see a gap in the ligament itself, and the gap is filled with fluid. Then you know that the ligament is torn. Look at this example. Can you see the anterior cruciate ligament? You cannot see. If you go to the corona, you don't see the anterior cruciate ligament in the notch. Then the ligament is torn. Look at this image. This is the normal anterior cruciate ligament, and here you do not see a ligament in the notch, and then the ligament is torn. The evaluation is much more easy in the coronal image. And in the coronal image, this is the normal ligament, and in this patient, you do not see the anterior cruciate. You see only the posterior cruciate. This sign is known as empty notch sign. Empty notch, empty from the ACL, but the BCL is present. Then what do you think of this? Is torn. The anterior cruciate ligament, there is a gap in the middle part of the anterior cruciate ligament which is filled with fluid. Then this ligament is torn. Then can you diagnose tear of the ACL from the plain X-ray? Yes. If you see that there is a fracture involving the site of insertion, which is the tibial spine. Then if you see the fracture of the tibial spine, and then you know that the ligament is torn, because this is the attachment site of the ligament itself. And this is the confirmation. The site of attachment is fractured and the ligament is torn. It's no more stretched, as I showed you. Then One of the helpful signs is to see bone marrow contusion, because rupture of the ACL is usually post-traumatic. Then trauma will result in bone marrow edema, and the edema means black in the T1 and bright in the T2. And this is bone marrow edema in the femur and bone marrow edema in the tibia, diagnostic of rupture of the ACL. Then this is bone marrow edema, black in the T1, bright in the T2. And bone marrow edema in the femur, black in the T1 and bright in the T2. These are helpful signs for diagnosis of ACL rupture. And one of the signs also is this sign, which is known as anterior translocation of the tibia. In order to test for ACL rupture, you put the patient on the table and you try to pull his tibia anterior. If it is pulled, then this is known as anterior drawer sign and is positive for ACL rupture. But in MRI, you draw a line posterior to the femur and the tibia. Both should be on the same line. If the ACL is ruptured, the tibia will be displaced anteriorly. Then you will see a distance between the posterior aspect of the femur and the posterior aspect of the tibia. And this distance is present on the lateral aspect, not on the medial aspect. You should go for the lateral meniscus, the site of the lateral meniscus, and you draw a line. Both femur and tibia should be on the same line, but if the tibia is anterior, this is one of the supportive signs that the ACL is ruptured. Then look at this. This is the lateral meniscus, and you draw a line. This is normal fine. The tibia and the femur are on the same line. But here you see a gap between the posterior aspect of the femur and the posterior aspect of the tibia, and this is positive for ACL rupture. One of the sure signs of ACL rupture is known as second fracture. What is this second fracture? Is a very small ship fracture of the lateral tibial condyle. Look at this X-ray. This is the tibia on the lateral aspect, fibula, and this is the medial tibia. And can you see this very small fracture? This is known as second fracture. And this equals 100% rupture of the ACL from the plain X-ray. If you see this fracture, which is a very small ship fragment from the lateral tibial condyle, this equals 100% rupture of the ACL. Okay? Then you can diagnose rupture of the ACL from the plain X-ray by two findings. Number one, fracture of the insertion site. Number two, the presence of the second fracture. Then, if the ACL is ruptured and the tibia will be displaced anterior, then the posterior cruciate ligament has a horizontal component and a vertical component. If the tibia is displaced anteriorly, and this vertical component will be more vertical, okay? Then if you draw a line like this, in normal cases, this line will touch the femur. But if the anterior cruciate ligament is ruptured, this line will not touch the femur, because the vertical part of the ACL is more vertical, because the tibia is displaced anteriorly. You understand? Okay. Then, look at this example. What do you think of this ACL? Is not black. All the ligaments should appear black in the MR image. Is gray. And in the T2 weighted image is bright, showing some fluid segment. Then what do you think? Is this ligament, if you look in the intercondylar notch, you can see the shadow of the ligament. Is this ligament is torn or not? We are not sure. And we call this a sprain or partial tear. Then how to confirm is by endoscopy. You do arthroscopy and look at the ligament if it is torn or not. Okay, this is an intermediate sign, not a sure sign of ligament rupture. Also, if you see that the ligament is not stretched, you remember the normal ligament is stretched, but this is lax, and we call this is partial tear. Partial tear. Then if you see this sign, which is known as single bundle sign, the anterior cruciate ligament is formed of two bundles. Then if you look in the MRI and you see this anterior cruciate ligament is intact or not? Intact. Okay? And here, ruptured. Yes? Then part of the ligament is intact and part of the ligament is ruptured. And this is partial tear. This sign is known as single bundle bundle sign. Then, if you look to the ACL and you see fragments, fragmented ACL is diagnostic of chronic tear. And here you see multiple parts of the ligament, fragments of the ligament, indicative of chronic tear. Then we have three types of tear: complete tear, partial tear, and this chronic tear, which is diagnosed by fragmentation of the ACL. Then look at this appearance. The ligament here is swollen, okay, and is not black. It is gray and maybe bright in the T2 weighted image. But if you look carefully, you can see some fibers of the ligament going through this area. And this is what we call mycoid degeneration of the ligament. Mycoid degeneration. There is no tear, but just degeneration. And this is the rare entity of the ACL. The common is the tear, partial or complete. But the swelling of the ligament itself and abnormal signal, meaning that it is mycoid degeneration. And this is an example. You see the ligament is swollen, but you can see some fibers of the ligament going through this area, and this is diagnostic of mycoid degeneration of the ligament. Then here also the ligament is swollen and some fibers are going inside the ligament, and this is mycoid degeneration of the ligament. Then what do you think about this ACL? It's swollen, but if you look to the T2 weighted image, you will see pure fluid signal. This is not tear and not mycoid degeneration. This is cyst of the ligament. It's known as intercondylar notch cyst or cruciate ligament cyst. It's different from tear and is different from mycoid degeneration. Then, what do you think of this ligament? This is mycoid degeneration. The ligament is swollen and there are some fibers going inside the ligament. Okay, this is mycoid degeneration. Then, if you look to this ligament, what do you think? Is it normal or abnormal? This one. Looks normal, okay? If the ligament is stretched and is okay. Then we accept in the ACL, if it is stretched, we accept linear shadows of abnormal signal. This is considered normal. Once you see the ligament is stretched and is of normal caliber, not swollen, then you consider the linear shadows within the ligament as normal findings. Okay? Then the BCL is cord-like, black structure, and is seen in every examination, whatever the angle is wrong or not. You should see the posterior cruciate ligament. Then you remember that there are two ligaments, the Humphrey and Wurzburg, anterior and posterior to the posterior cruciate ligament. How can you diagnose rupture of the posterior cruciate ligaments? By two findings. Number one, swelling. Number two, abnormal signal. The normal signal is black, as you can see here. The normal signal is black. But if you see that the signal is bright and that the ligament is swollen, equals complete rupture of the ligament. Then this ligament can also rupture through avulsion of the fragment attaching the ligament to the tibia. And you see here, this bone fragment was attaching the ligament to the tibia, but post-traumatic, the fragment was avulsion. What do you think? This ligament is torn or intact? It's torn. No, the ligament substance is intact, but it's not fixed to the tibial attachment, then it's torn. But the ligament substance itself is intact. And this is what we call avulsion tear. Then partial tear means that you have some intact fibers and some disrupted fibers. This is clear for the BCL, but for the ACL you have to see whether it is lax or not. There is a single bundle or other bundle, but in the posterior cruciate ligament, it's easy for you to see intact fibers and disrupted fibers. Then you diagnose partial tear. And here, intact fibers, torn fibers, intact fibers. And this is tear of the partial tear of the posterior cruciate ligament. But if you look to this ligament and you see there are some areas of gray appearance within the ligament, and this is degeneration. The tear of the BCL, the ligament is swollen with bright signal. Partial tear, some fibers are intact, some fibers are disrupted. Degeneration, the ligament is okay, but contains areas of gray signal, and this is degeneration of the ligament itself. Then finally you came to the collateral ligaments. And the collateral ligaments, we have the medial and the lateral. The medial one is very close to the bone, and the lateral one, you should see the head of the fibula in order to know the lateral collateral ligament. Then we have 3 grades of injury of these collateral ligaments. Grade 1, the ligament is okay, but you see minimal fluid around the ligament. This is what we call grade 1. Grade 2, the ligament is thickened and is away from the bone. And here you can see the ligament is thickened and is away from the bone. Grade 1, you see only fluid signal around the ligament. Grade 2, you see the ligament is thickened but is away from the bone. Grade 3, complete rupture. And you see this ligament is not continuous to the tibia, it's ruptured here. Then grade 3 means complete rupture. And this is another example. This is the the medial collateral ligament, and is not continuous to the tibia. It is torn and extended up like this. And this is grade 3 of the medial collateral. Grade 1, minimal fluid around a normal ligament. Grade 2, the ligament is thickened and is away from the bone. Grade 3, the ligament is completely ruptured. And I thank you very much.